Greetings from the Prince County Hospital Foundation. My name is Heather Matheson. I am the Managing Director of the Foundation, and it is my pleasure to welcome you to the virtual annual meeting of the Foundation. We are always proud to report on the activities of the Foundation and present the financial picture following our annual review by the audit team at Grant Thornton. This took place in February, and the results were delivered to us by Zoom at our March board meeting. At this time, I would like to call this meeting to order for the purposes of conducting the business of the annual meeting. Our agenda will include comments from the 2020 President, the PCH Acting Administrator, President of the Auxiliary and of our Youth Board, and we will cover the 2020 financial status as well. That was outlined in our annual report and financial statements. With that, we will start off with comments from Paul Young, Acting Administrator with Prince County Hospital. Thank you.
Thank you, Heather. Good evening. As Heather noted, my name is Paul Young, and I am the Acting Administrator for Prince County Hospital. It is my pleasure to have the opportunity to address you all this evening. Healthcare is always changing. The methods used, best practices, the equipment required, and the needs of our patients are ever changing. The Prince County Hospital and healthcare on PEI experienced unprecedented challenges over the past year, the impact of which will stretch far into the future. Prince County Hospital leadership team couldn't be more proud of our staff, from the physicians to environmental services team to our nursing teams and everyone in between. Every one of our staff pulled together to make sure that your hospital was prepared to meet any challenge, including the prospect of COVID-19 arriving at our doors. We were all touched and inspired as well by the community support shown to frontline staff in a number of ways, starting with the fulfillment of specialty COVID equipment needed last spring. The community banded together and supported the hospital's greatest needs through the Foundation's Vital Signs Appeal, allowing us to purchase every item for every department. Thanks as well to the community for going above and beyond with numerous donations of food, masks, and more for the staff of Prince County Hospital. This was appreciated by all in such an uncertain time. As the Acting Administrator for Prince County Hospital, I would like to thank my predecessor, Lean Gallant-Bernard, for her long tenure with this hospital and her commitment to its well-being. We wish her nothing but the best with her future endeavors. For now, I look forward to stewarding Prince County Hospital with care and attention alongside the wonderful team of healthcare providers. Prince County Hospital continues to work through some prominent challenges, primarily related to staffing, both nursing and physician related. We are confident in the groundwork that has been done. These ongoing efforts will yield results that will not only help sustain our services, but the due diligence being invested into understanding the reasons and learnings derived from these challenges will help create long-term sustainability and future growth. In closing, I would like to say thank you for your support, the Prince County Hospital, the support of our Prince County Hospital Foundation, and all our healthcare professionals within its walls. I would now invite Rick Kennedy to provide the financial highlights for 2020. Thank you.
Thank you, Paul, and good evening to everybody. Again, my name is Rick Kennedy, and I was Treasurer for 2020, and I'll provide the Treasurer's report. The Prince County Hospital Foundation experienced yet another tremendously successful fundraising year in 2020. When our offices shut down in March 2020 at the onset of COVID, we had no idea how the year would unfold. But once again, our community stepped forward, and in a huge way. Our 2020 annual equipment goal was $1.485 million. In April, a further $70,000 was added to the goal for COVID-19 related items. We are happy to report that we surpassed this goal and will be able to purchase every piece of equipment on the needed equipment list for 2020. We will begin the review of the year by reviewing the revenues and some expenses. First, the revenues. Total revenue for 2020 was just over $5.3 million. This total includes investment income and funds raised from the annual campaign, which consists of our annual mailouts, Lights for Life, and Grassroots and Cowboy Boots event, just to name a few, plus insurance policies and a number of gifts received from our endowment fund. The total investment income for the year was $1.335 million, which we are very pleased with considering the state of economy for 2020. Breaking this $1.335 million down a little further shows that investment income, including dividends and interest received, less portfolio fees incurred for the year, were just over $732,000. Realized gains on the actual sale of investments were over $335,000. And investments measured at fair market value recorded an unrealized loss of just shy of $133,000. As an indication of how markets can fluctuate and how 2020 did pose its challenges, this $132,000 loss compares to an unrealized gain of some $1.3 million in 2019. Our endowment fund includes gifts received from wills and donor endowed gifts, and in 2020 we received $1,874,489. These legacy gifts were set up as endowments, meaning the principal donation amount stays intact and only the interest earned from this gift is used as the board determined or in the annual equipment campaign if so instructed by the donor. This type of gift ensures a bright and healthy future for this hospital. The remainder of the total revenue can be attributed to other campaign activities, which would include, but not limited to, gifts totaling $35,000 were received from the Prince County Hospital Auxiliary in the year. Lights for Life raised an incredible, and I believe a new record, of over $289,000. And over $600,000 was received in cash and pledge payments from previous years in relation to the Grassroots and Cowboy Boots event. This event has become the largest event supporting the foundation and in turn the many islanders who rely on this hospital every day. This vital fundraiser was challenged to comply with COVID-19 restrictions in 2020, but was still incredibly successful thanks to Warren Ellis, his family, and the rest of his volunteer team. Our May, September, and year-end Vital Signs mail-out campaigns raised over $186,000. Memorial donations made in the memory of friends and loved ones raised over $75,000. We also received $250,000 from the provincial government, which is the third installment from the commitment in September of 2018 of $1 million to be paid over 4 years. The Prince County Staff Initiative Working to Win draw raised over $54,000. The Toonies for Youth draw raised over $33,400, which was impressive in a year where it was paused for several months due to the pandemic. The remaining revenue can be attributed to a list of other activities held during the year, including the Women's Golf Classic, third-party special events, and our major gifts, corporate and personal ask program. It is important to know that every pledged donation, memorial gift, donation to our mailouts or Lights for Life means a great deal to the people throughout our island communities who are served by the PCH. We are truly grateful for everyone who takes the time to ensure this hospital is supplied with up-to-date medical equipment. Now on a few of the expenses. It should be noted that 100% of our operating expenses are paid out of returns from investments, and therefore we are proud to say that 100% of donations to the annual equipment campaign are used directly to purchase equipment. This is due to the foresight of previous donors who have left a legacy gift to the foundation. Some of these donations are recent, and some others date back over 70 years. This is truly a lasting tribute by these donors. Fundraising and operating expenses, which include salaries and major fundraising costs for our annual programs such as direct mail-outs, Lights for Life, planned giving, office supplies, and other fundraising activities and special events total just over $516,000. We are proud that we are the trustees of 2 education funds for the nurses and staff of the PCH. In 2020, $3,638 was awarded to nurseries in Prince County from the George Wilkinson Nurses Bursary, and another $6,288 from the Prince County Foundation Continuing Education Bursary was awarded to the staff of PCH. In 2020, $1,538,256 was transferred to the PCH to purchase needed medical equipment. This report only highlights our 2020 financial statements. Copies of our complete audited financial statements, as Heather noted by Grant Thornton, may be obtained from the Foundation's office. The Foundation is proud of our fundraising activities and our stewardship of resulting funds. We endeavor to be completely transparent and hence welcome any questions at any time. This concludes my Treasurer's report, and I would like now to invite Betty Robertson, President of the PCH Auxiliary, to the podium for her report. Thank you.
Thank you, Rick. Good evening. Prince County Hospital Auxiliary started work to reorganize the Wishing Well Gift Shop in January of 2020. We had no paid employee as of the 19th of January 2020. The Auxiliary set up committees to run the gift shop. Thelma Phillips set up an official guideline for the volunteers to follow. We set up committees of 2 co-chairs, finance, merchandise committee, public relations, and volunteers. Inventory was done and the shop closed for renovations on January 27th, 2020. With a great deal of help from Heather Matheson and her staff and the hospital maintenance department, the shop was revamped, painted, and a new slat wall was purchased for the shop and paid for by the Foundation. The shop had a soft opening on March the 13th, and a couple of days later, COVID hit and the shop closed down. The Wishing Well Gift Shop remained closed from March the 16th to May the 31st, 2020. We reopened June the 1st until the present time, except for the 2 weeks of the circuit breaker. A questionnaire was done by the auxiliary members on how to improve services in the cafe and circulated by the Foundation office to hospital staff. We received 100 replies with some very good suggestions. The provincial meeting of the Association of Healthcare Auxiliaries was canceled, but the executive remains in place for 2021. The Christmas raffle basket brought in over $3,700. The make-believe tea about $2,700. 2 fundraisers were canceled, the clothing sale and the gift wrap. Other sources of revenue were the Starlight Coffee, the cafe. Lifeline brought in $6,700, and the ATM's $3,600, and $14,000 was made from the gift shop for a total of $38,455. The corner cafe, the auxiliary gave out 3 bursaries for $500 each, $33,000 to Prince County Hospital Foundation for Equipment Fund, $2,000 for Lights for Life, $800 was given to the Palliative Care Committee, and $550 to Mental Health. At our Christmas meeting, we collected $284 for the Salvation Army, as well as their food donations. The Prince County Auxiliary has 26 hardworking, dedicated members, and the gift shop has 35 members. It's my privilege to introduce from the Youth Who Care, Emma Harris.
Thank you, Betty. All right, so the Youth Who Care Board has had a very successful and busy year considering the circumstances this year has brought our way. Through productive meetings, fundraisers, and helping out in our community, we've been very involved and have done our best to better our community this year. Our most significant projects were making a spring basket and selling tickets for it, creating Valentines for the patients in the hospital, and volunteering at different places when we had the opportunity. This year, we worked extremely hard to fundraise for our hospital foundation and got creative to think of ways we would be allowed to raise money with COVID restrictions in place. Our spring basket was valued at over $400 and included various gift cards, spring necessities, and more, completely supported locally. We had the opportunity to sell tickets on the weekends in March at the farmers market and through the week at the hospital. We've raised $629 for this basket, which was a pretty big accomplishment for us. In February, we had a very productive meeting creating handmade Valentines to distribute to the patients in maternal child care, inpatient mental health, and medical palliative, and surgery restorative. Making these cards meant so much to me, as some patients may not be fortunate enough to see their families often with COVID restrictions or may have family across the bridge. Furthermore, we've had opportunities to volunteer a couple of times at the free store, helping sort clothes and new donations, and at the hospital gift shop. At the beginning of the year, we also had the chance to help out at the Rotary Book Fair, all of which were great learning experiences and allowed my board members a chance to receive a little more volunteer hours. Finally, we ended our last meeting with two incredible guest speakers from the hospital. Andrea Wild, the nurse manager of the obstetric and pediatric department, and Angela Carriger, who is the physiotherapy supervisor at PCH and the rehabilitation services supervisor at Community Hospitals West. They both spoke to us about their roles in the hospital, and once again had me contemplating my career path with their convincing words and the love they have for their jobs at Prince County Hospital. Working my way up to president of this board has been an honor. From the beginning of my time on the board since grade 10, I knew I would be devoting to help out as much as I could, and could definitely see myself leading the board when I got to grade 12. Now, here I am, proudly speaking of my board full of amazing youth and all the great accomplishments we've made together this year. I'd like to thank my mentor, Heather Matheson, who has been an amazing role model these past 3 years. Always giving me useful leadership tips and adding a clever spin, Heather works nonstop and showed me what it really is to have a phenomenal work ethic. Overall, we've had a great year, always doing our best and adjusting to the restrictions put in place. The Youth Who Care Board allows a voice for youth in our community, which I believe is very important. I'm so glad I got to lead this group this past year and help make a difference. Although there were restrictions, we still found creative ways to make a positive impact on our community and even raise a little bit of money for our local hospital foundation. Thank you so much for this opportunity to speak on behalf of the Youth Who Care Board, and I look forward to seeing what it has in store for the future. I would now like to welcome our president of 2020, Liz Maynard, to the podium.
Hi folks, my name is Liz Maynard, and I had the privilege of serving as president of the foundation for the years 2019 and 2020. At the beginning of 2021, I transitioned into the role of past president as we welcomed a new executive team. And I would like to announce the 2021 executive team and our new president, Rick Kennedy. Our vice president is Gordon McFarlane. Our secretary is Derek Bond. And our treasurer is Les McLean. So that's our new executive going forward, and as you were a few months into the year already, they're obviously hard at work. So as part of the annual report and annual meeting, it's time to take a bit of time to reflect on the year that was 2020. It was an exceptional year in many ways for many people. In early March, we were prepared to launch our annual public campaign to raise funds for medical equipment. But before the month's end, things changed, as we all know, and lots of stuff put on hold. COVID-19 came along and changed life for us, and of course changed life within PCH. As the hospital shifted focus, we followed suit, producing a short-term online campaign to fulfill equipment needs such as has been mentioned, the gyroscope, ventilators, and much more. By June of 2020, things had seemed to settle down enough on Prince Edward Island for us to resume our appeal as we worked our way towards our goal of $1,485,280. This goal was needed to be met to keep PCH up to date with medical equipment in 2020. Adaptation became the way to move forward. a sentiment shared by so many people in the business community. With each turn, we needed to adapt our fundraising methods. But we were thrilled to see that our community was behind us 100%. Thanks to the donations of our caring communities, we were able to raise enough money for the purchase of every single item on the list of the 2020 greatest needs list for the Prince County Hospital. A remarkable accomplishment in such a remarkable year, I might say. In April, just gone by, we've distributed our annual report for 2020 as part of our newest Caring Connections newsletter. And as you know, those who have had the opportunity to receive and read that, all those donors who gave over $500 are listed as part of the President's Society so that we can thank them for their generous support. The publication also featured many other pieces of interest, including a touching story on monography, a tribute to our friend Walter Reel, who has been a supporter and I believe past president of the foundation, who we lost during 2020. A list of the legacy gifts was also included in this publication that we received in 2020, as well as a snapshot of our financials, which Rick has highlighted for us earlier. So if you have not received or would like a copy of that report, it can be found online at pch.care, or of course you can pick it up at the foundation office. So my wonderful time as president of this organization came to a conclusion at the end of 2020, and I would like to, at this moment, thank all of the caring communities for your support during my tenure. Also, thank you to the staff of the foundation for their commitment and resilience during an extraordinary year. Finally, I would also like to thank my fellow board members, past and present, for their camaraderie and their expertise. And now it's my pleasure to call on Dr. John Morash to receive the ceremonial check on behalf of the Prince County Hospital Foundation from us to the hospital. And this check represents the funds that was raised in 2020 through the steadfast support of all our donors. Dr. Morash, I'll ask you to say a few words.
Certainly, thank you. Thank you very much, Liz. It's my honor to accept this on behalf of the frontline staff working at Prince County Hospital, the physicians, the nurses, the environmental services, everyone who's been really gone above and beyond for the last year. As everyone has touched on, this has been an unprecedented year, and it's really heartening to know that the community that we work so hard to try to support is giving to us so that we can keep doing that. We wouldn't be able to staff or to properly equip our hospital without the generous support of everyone that's given to us, and I'm very grateful for what everyone has done. So thank you very much.
I want to thank once again the community for such a great year of support despite all the challenges. And I want to thank the team at the Prince County Hospital for their commitment and their dedication. So we hope you have enjoyed this 2020 annual meeting and you found value in the presentations. And of course, if you have any questions, we're more than would like to help you, and certainly will help you at the foundation office. And I hope you've enjoyed your viewing of this event. And of course, I want to wish you good health and well-being as we all move forward to support the Prince County Hospital and getting better together. Good evening.